Hey guys, it's Hina Sheth here at Rebalance Physical Therapy in Center City, Philadelphia, as well as on the main lines of Philadelphia and Narberth, Pennsylvania. Today I want to talk to all of you who might be experiencing something called a sports hernia, or in more medical term is athletic pubalgia. Now some of you may have been Google searching this because you're starting to experience symptoms in the groin area, or perhaps you went to your physician or sports medicine doctor and they diagnosed you with, again, sports hernia or athletic pubalgia. And so what is this? I'm not sure if you have either understand the correct explanation of this or if your physician explained to you what it involves. But basically, anytime you are experiencing pain in and around the groin area, and maybe it might even radiate down into the inner thigh and even into the lower abdominal region with sports types activities, or even other activities that are simpler like walking, getting up from out of bed, twisting or turning in bed. Those things sometimes can be diagnosed as, again, sports hernia or athletic pubalgia. Now, what is this? So I want to show you a picture here of the front of the body. Now, this is the front of the body. Here's the abdomen. Okay, and you see that these abdominal muscles come down and they attach onto a bone here called your pubic bone. Okay, this pubic bone is part of a larger bone called your ilium, which is part of the pelvis, and I'll show you a better 3D model of it in a minute here. Now, you can also see that there's a bunch of hip muscles here in the front, and many of them also attach to the pubic bone. Now, the pubic bone is here and here, not this guy right here, but this is a pubic bone, and this right here is part of a ligament called your inguinal ligament. Now, as you can see, these attachments from the abdominals, as well as these inner thigh muscles here called your adductors, and there's a few of them here, okay, they insert and they attach in this area. Now, if you have any injury to these attachment sites of these muscles, okay, whether it's a tearing or a weakening of the tendons and the muscles, okay, tendon is an extension of the muscle that helps to attach onto bone. Basically, that will be diagnosed as a sports hernia or athletic pubalgia. Now, why does this happen? Now, for, I would say 90-something% of the population, it doesn't necessarily come about through a specific injury, meaning it's not like you planted and twisted or you kicked really high and you felt it immediately. Most of the time, these things usually start out gradual and then they become worse over time. Now, the typical activities, and the reason why it's usually called sports hernia, is because you usually see it with higher level athletic activities that involved, kicking, twisting, those types of activities. However, in the population that we see at our clinic, we actually see that this can happen to other people that don't necessarily do high-level sports. For instance, I had a lady that came into our clinic that actually ended up having this after delivering her baby. So again, it's just a terminology that says that you've got pain in this groin area, and usually it's, there's not a specific hernia per se, and a hernia means that there's organs that are protruding out of the abdominal area. That's not really what's going on. It's actually the muscular tendon attachments in and around the pubic bone in this area that either on, radiologic imaging, they find that there's tearing or weakening, or perhaps you went and had it diagnosed by a physician and they labeled it as, again, sports hernia or athletic pubalgia. So, again, this can come about usually through sports or doing a lot of higher level abdominal exercises, twisting activities, and kicking activities. But again, it can also come about because, again, after childbirth, or perhaps your mechanics in terms of your body mechanics are incorrect. And so you end up stressing this area unnecessarily, even with your daily activities. So if we take a look at the model of this pelvis, okay, you can see here that this is the pubic bone right in through here. And again, this is a ligament right here, even though it kind of looks like bone. But here is the ligament. If I turn this to the side, you can see the ligament is cut out, but then there's more bone that actually extends from this pubic bone. Now, the symptoms that most people might feel is, kind of like a stabbing, maybe shooting sensation, an aching, a throbbing sensation in the area of the lower abdomen, in and around perhaps even the pubic bone, and even into kind of the inner thigh area, okay, which would be more right in through, down through here, okay. This would be considered kind of the groin area right in through here. And sometimes you might have it, again, with usually doing some type of activities, rest, laying down usually helps it. But even with coughing and sneezing, sometimes you might feel it, or with abdominal exercises, you feel this pain. So why does someone develop this? Now, sometimes it's because you're doing things abnormally, meaning you might be doing abdominal crunches, you might be doing twisting and kicking activities, and you're not using the right musculature, or you end up doing too much of this, okay, with the improper body mechanics, and this ends up overstressing these tendons, and over time you get tearing and irritation and inflammation and weakening of these muscles. Now, if you're doing things incorrectly, it could be due to, a lot of different things, which I'm going to talk to in a minute. Now, for those of you where things might have come on gradually and you didn't do something that was kind of the weekend warrior type twisting and bending and lifting and abdominal activities and kicking activities, some of you, this may have come on gradually and may not have even come on because of a sports injury. So what's going on there? So we all have to realize that we're all interconnected in many different ways throughout the body, okay? There's something called fascia, there's other things called muscle, and then there's your bone as well as your ligaments that connect the whole body together. And that's how different things are interconnected from your head literally all the way to your toe. We are all interconnected through muscle, through fascia, through ligaments. And when something in one area is off, you can easily compensate in another area to make up for that. And now when we're younger, okay, when we're in our teens and our 20s, we can get injured and we recover really quickly. However, as we continue on this pathway and our lifestyle changes or our activities change, or we become perhaps more sedentary in our 30s and our 40s, usually what ends up happening is now the compensation that you're doing throughout your body doesn't hold up, and you're not as resilient to that anymore. So I'm going to give you a typical example of things that we see in our clinic. So again, you take a look at this pelvis, okay? And you can see that it's basically like a ring type structure, okay? And if you look at this pelvis, okay, you have connections in the front through the pubic bone, okay? And then you also have connections in their back. This is called the sacroiliac joint. So it's one big ring and it's all interconnected, okay? Now here is the spine, all right? So this is where your low back, you have a lot of different segments of your spine that come into play. Now, say if somebody doesn't have good flexibility through their hip. So here's the hip joint. This is where your leg comes out of. If you don't have good flexibility in your hip, okay, say it's more one-sided than the other-sided, and in through the joint, say that joint isn't moving very well, then what can easily happen is because you don't have that flexibility, but you need it in order to walk or to perform these sports activities, what's going to end up happening is you might end up having to overuse this joint in the back, which is your sacroiliac joint, or even perhaps higher up into what's called your lumbar spine or the low back. You have to overuse these joints and kind of have them move to compensate because of the lack in the flexibility of your hip. Or perhaps you had an injury in the past. Maybe you fell on your tailbone, or you did something where your pelvis is off, and now you've got asymmetry in you have asymmetry in these pelvic bones, and that changes the way that all the other muscles that attach, there's a bunch of other muscles that attach onto this pelvis. It changes the way those muscles have to function. And so what ends up happening is these other muscles in the front, the abdominals and the inner thigh muscles, might have to work differently in order to make up for the lack of flexibility, say in your hip, or because of this asymmetry that you have around your pelvis. And now you have muscles that aren't working in nice synchrony and harmony to each other. And so now you basically are putting more of the workload on the abdominal muscles, as well as the inner thigh muscles that attach up onto this pubic bone. And that ends up over time creating irritation, weakening, and perhaps tearing of this area. Okay, so now those are just two examples, but I have examples of lots of people where their upper body, it was the main issue, where they might have a lot of issues up and through the upper back, head and neck, and even in through the rib cage, okay, and they end up maybe perhaps twisting their upper body in one direction, but because you have to still maintain your head forward, you have to twist the opposite way down below. So your pelvis has to twist this way, and that twisting leads to, again, different workloads from one side of the hip to the other. And often with sports hernia and athletic pubalgia, oftentimes you're having these symptoms one-sided over the other. Sometimes they can happen in both, and one side is worse, but usually it's more one-sided versus the other. So you can see how even upper body compensations can actually change you down below, and that can, create a whole, what's called a biomechanical change in the way that you use your muscles, and now you're overusing it. Now, some of you may have already had treatment. So what do you do about this, right? So you go out and maybe you had treatment. Some of you may have had, perhaps something more invasive like an injection. Maybe some of you guys have been on medication and just to help settle it down and you were told to rest. And then maybe some of you have gone to physical therapy, did some basic traditional strengthening, stretching exercises. Some of you may have gone to a chiropractor and had some adjustments. And some of you may have gotten better, and that's great. But maybe there's a whole nother patient population out there, perhaps some of you guys that are watching this video, that are still continuing to have these symptoms that you're like, you know what, I've tried a lot of different things and it's still not working. And this is what we see in our clinic is these patients that have already had some type of conservative treatment, and perhaps it got a little bit better, but it never fully went away. Or perhaps it started as this, or it started as something else, and now it's developed into a sports hernia. And now they're just like, you know what, I have upper back issues, I've got hip issues, I've got pelvic issues, and you feel like, hey, one thing has led to the other, or you've had all these other injuries, and now on top of it, here's the sports hernia that's you've been diagnosed with. And it's frustrating, and I get it, because this is what we see all the time in our clinic. So what is it that needs to be done? Now, obviously, if you live in and around the Philadelphia area, I mean, we have patients that even come all the way from Maryland and Delaware and New Jersey that come see us. But if you live in around this area, then obviously come in and have an evaluation with us, and we'll take a look at a lot of these things and find out what's going on. And for some of you that don't live in this area, you're really going to need to look for someone who understands the orthopedic side, okay, of these injuries, but also someone that perhaps understands the pelvic floor side of these issues. And I'm going to explain to you why this is important. So again, if we take a look at this pelvis, okay, you've got lots of different muscles that attach here, okay, so these are your glute muscles. You've got muscles that attach here, which are the inner thigh muscles, okay? You've got muscles that attach here, which are your abdominal muscles. And if you flip it around to the back, you've got all these low back muscles, okay? Now, if you look on the inside of the pelvis, okay, this is called your pelvic floor, okay? If you turn it underside, okay, and you see the pubic bone here, and if you keep turning around, you see the tailbone here, you've got all these other muscles that many physical therapists, chiropractors, a lot of other musculoskeletal experts do not specialize in and do not fully understand the scope of how this can actually impact the entire pelvis, okay? And so someone that understands all the different attachments of the musculature around the pelvis on the outside, as well as in the low back, as well as the inside of the pelvic floor musculature, that's somebody that's going to be able to understand how changes in your pelvic alignment, issues in the hip, as well as in the spine, can have an effect and create imbalances that now make the abdominals and the inner thigh muscles overwork and create tension. And this is what our job is to figure out a couple of different things. One is which muscles are overly tight, okay? That might be, you could have had tightness in the past, or maybe you've developed it because now you're guarding and compensating, but we need to figure out where all of those imbalances, so tightness as well as weakness, are both on the inside as well as the outside of the pelvis and of the musculature, as well as the symmetry of what this pelvis looks like. And is it due to tightness in the bones themselves, okay? Or perhaps it's too weak and you have too much movement, and is that because these ligaments, okay, ligaments are tissue that hold bone to bone, are too loose and not allowing good stability or closure of this, what's called the bony pelvis, allowing the muscles to work well? Or is it something further up or further down that's creating changes and compensations in this area, okay? And that's what the job of a good pelvic floor therapist that also understands orthopedics is here to help you do. And this is what we do every single day. And these are the type of clients that we often see that have been having chronic hip, pelvic, spine, pelvic floor issues, and that they've already, tried to have treatment or conservative treatment, but they're still being bogged down by this ailment and impairment and dysfunction, not allowing them to participate in their sports, not allowing them to simply take a walk outside, take care of their children or their grandchildren, work out in the garden, simply get out of bed, or even for some people have pain-free intercourse, or even attend a yoga class. Like all of these different things that really give us enjoyment in our life and enhance our quality of life. If this is bogging you down, then this is what you need to help find. Now, again, I was saying, if you live around this area, it's very obvious. Come in and see us. This is what we specialize in, do pretty much 100% of our day, where we really look at someone holistically. And because we have so much experience in treating this area, this is something that's not sometimes that difficult to treat. However, if you don't live in this area, then I would say, look for someone with those expertise. And I usually tell people, if you really have a hard time finding someone, then, you can always contact us through our website, which is rebalancegt.com. That's REBALANCEPT.com. Shoot us an email and we can help you try and find someone or locate someone in your area that might be able to help you get this under control and help improve your symptoms. Okay, so I hope that was beneficial for all of you. Again, we have lots of other YouTube videos that might be helpful in kind of putting the pieces together, not only on this dysfunction, but many other things. So again, come to our YouTube channel, which you can get through our website, or perhaps it piggybacks onto this. And again, it's Rebalance, REBALANCEPT.com. And I will talk to you soon. Take care. Have a great day.